And welcome into To Your Health. And we're thrilled. We have one of only 3 satellite UAB residency campuses, and we are fortunate enough to have one in Montgomery, Alabama. And we have with us today the former dean, Dr. Wick Many, and we're going to try to give you some information that I know a lot of you have had questions about with an outbreak. And Dr. Many, your specialty is infectious disease.
That's correct.
So let's talk a little bit about this. It's hard to pronounce, so I'll leave it up to you.
Cyclospora.
Thank you.
So Cyclospora is a parasite. It's a free-living organism, and it is transmitted through contaminated water or contaminated food products. So you do not ingest the parasite, you ingest the eggs of the parasite. And then the eggs have to sort of germinate in your intestine. And then when they do germinate, they become aggressive and invade the intestinal lining and cause the diarrhea. So this is different than a lot of other type of foodborne outbreaks where you have symptoms within the first 24 to 48 hours. This is why it is so difficult to track down the exact source of this or outbreak, is because the symptoms usually don't develop until 7 days after you ingest the contaminated food. So it's very difficult then to pinpoint exactly where you ate the food or what type of food you ate. And it causes primarily a severe gastrointestinal illness, nausea, vomiting, but the more significant symptom is diarrhea. And the diarrhea is described as being quote unquote explosive.
Right.
So it can be severe. Now, it is not life-threatening unless you are prone to dehydration.
Wow.
So if you can maintain hydration, you're a lot likely. But in individuals who are immunocompromised, so if they're on cancer chemotherapy or transplants or people who have uncontrolled HIV infection, the diarrhea can become chronic. In other words, last for a long period of time. It is important for the physician to know that possibility of Cyclospora because in routine stool samples for culture, so if you do, someone presented with diarrhea and you're concerned about a bacteria such as Salmonella or Shigella, you would order a stool culture. Well, this organism does not grow in culture. It's a free-living parasite. So you have to order special stains on the stool. There's a stain that you can do. There's also a molecular test that can be done. But unless you suspect the diagnosis, the physician will not order the correct test. Fortunately, there is a treatment for it. It is an antibiotic called trimethoprim sulfa. The trade name is Bactrim or Septra. A lot of people take Bactrim Septra.
Right.
And you take the medication for twice a day for about 5 to 7 days, and it will eradicate the process. Unfortunately, as I mentioned, in people who are compromised in any way, even with treatment, it can become a chronic process, or at least a relapsing process. So how do you prevent yourself from developing it? So it is contaminated like lettuce and berries, basil, cilantro, particularly if you get bagged lettuce or bagged salads, because those are not washed individually. So you want to prevent yourself, if you do have those, you have to wash your lettuce extraordinarily well, wash your cilantro, wash your basil, wash berries, raspberries, blueberries extremely well, and always hand washing. Infectious disease doctors, that's their mantra, is hand washing all the time. So good hand washing. If you are going to have like lettuce or basil or cilantro, make sure that you wash it thoroughly before you eat it. And if you cook, for some reason, cook things, it is killed by cooking. So you don't have to worry about cooked foods. It's mainly the fresh vegetables and fresh fruit that are the risk factors.
And you basically have no way of knowing what is contaminated. Is
Correct.
that my understanding?
Correct. And that's why because of the delay in onset of symptoms, a lot of folks will forget, well, I ate here or I ate there or I ate this or I ate that. So they're trying to track down the exact source. Right now, the major outbreak is in the upper Midwest and in Michigan and in surrounding states. There have been 11 cases in Alabama. 2 of them are imported internationally. But we always have Cyclospora in Alabama. I mean, it's not unusual to have it, but usually 25 to 30 cases a year are not unusual in Alabama. But so far there have not been any cases in Alabama that have been linked to the outbreak in Michigan.
where does it actually come from to get on the lettuce?
It lives. It's a free living parasite, so it lives in water. So many people have heard of amoeba.
Right.
So it's in the same family as an amoeba. So it lives in water, and people ingest it and pass it on in the stool and the groundwater. So if you use groundwater for irrigation of your plants,
right.
That's how it gets on the plants.
Whoa. So this is very difficult to escape.
It's not very difficult to escape if you use common sense. Wash everything and wash your hands. And again, just avoid products that may have a higher risk.
Okay. Well, you've got me washing my hands.
Correct.
And you have taught me well, and it probably might not be, the hand sanitizer when you go out to dinner or...
Hand sanitizer does not work. You need to use good old soap and water.
Soap and water, okay.
Yeah, warm soap and water, and you wash for as long as you can sing the ABC song. That's the easiest way to remember how long to wash your hands.
Okay.
You just sing the ABC song at a regular pace, and that's an adequate period of time to wash your hands.
Well, thank you so much, because I know infectious disease is a fascinating specialty,
That's why I did it.
I know, and there are not very many of you.
There's not that many. We need more.
Yeah, we do. We
need more, especially here in Montgomery.
Thank you so much for taking your time to come in.
Always glad.
And everybody, this will help you, so pay attention, and maybe we can keep you from getting sick. And thank you for being with us, and we'll be right back.